Many oral health might have taken a back seat during the pandemic. So with May being Save Your Teeth Month, this morning we have some tips to help you keep your natural teeth healthy and avoid a dental emergency. Dr. Stefan Zweig is the president of the American Association of Endodontists, and he joins us to talk about Save Your Teeth Month. Good to have you, Dr. Zweig.
Thanks, Cameron. Nice to be with you.
So, Dr. Zweig, what's the difference between an endodontist and a general dentist, and when do you know you need an endodontist?
So an endodontist is a dentist who's received an additional 2 years of training in the diagnosis of dental pain, tooth pain, also learning how to do root canals and helping patients save their natural teeth. So a lot of the patients that endodontists see have pain, and so when you have dental pain, you're probably most likely going to want to see an endodontist. Now, not everyone who needs to see an endodontist has pain, but that's a really good indicator of when you might need to see an endodontist.
And in addition to having that mouth pain, is cracking a tooth another reason to see an endodontist?
Yeah, so we've seen a lot of patients, especially over the last couple of years, who crack teeth. And the reason is because they're under a lot of stress, they're grinding their teeth, and they're cracking their teeth. So many times when a tooth is cracked, the patient is in pain, and of course endodontists treat dental pain. So it is important to take care of cracked teeth very quickly. Many times cracked teeth do require root canals, and endodontists are specialists in doing root canals, so it only makes sense to see an endodontist when you have a cracked tooth.
And why do endodontists support saving your natural teeth?
Well, at the end of the day, there is no replacement for your natural tooth. So, losing a tooth can be debilitating. It can affect the way you chew. It can affect the way you eat. It can actually affect you in ways that you don't even think about. So, the aesthetics of how a missing tooth looks could affect the way you relate to people. It could affect your job. So, it's very important to save teeth. The loss of a tooth can be very debilitating, but it's also very complicated, time-consuming, and expensive to replace a tooth. So we recommend that when at all possible, to actually save your natural tooth. It's really the best way to go.
And what preventative care can people take to avoid that dental emergency?
So of course, good dental care starts at home. So we do encourage people to brush their teeth regularly, 3 times a day, and to floss, and to really just be very aware of their dental, of their own dental needs. Beyond that, we do also encourage patients to visit their dentist frequently, twice a year, where you'll get a professional cleaning and you'll get an examination by your dentist to sort of see what's going on in your mouth, and to find small problems that can occur, and that they can take care of very easily. If you neglect yourself and you go past that point, you may end up with a much larger problem that requires much more extensive treatment. And this happens occasionally.
Well, I know if people need more information or to find a local endodontist, they can go to findmyendodontist.com. Dr. Zweig, thank you so much for joining us today.
Thanks for having me, Cameron.
We'll be right back.